Thank you, Dr. Priya, for your wonderful introduction. Let me share my screen to every one of you. Okay, greetings from Taiwan. It's really my great pleasure to be here with you today to have a conversation on the topic of challenges and future prospects in nursing and healthcare. And healthy people in 2030 has an increased focus on social determinants of health. According to WHO, determinants of health can be divided into three categories. The first level is individual lifestyle factors, such as age, genetic factors. And the second level is social and community network. And the third level is general social, economic, political, cultural, and environmental conditions. Can you hear that? And the vision for nursing, this framework is outstanding, is according to the National Academies of Sciences and Engineering and Medicine in 2021. This framework highlights critical areas to strengthening nursing, including workforce, leadership, education, well-being, and emergency preparedness. We nurses, we are the key in addressing both medical and social determinants of health. And during the evolving change, challenges such as demographic, technology care models, and public health emergency changes are those issues we need to ensure policy and regulations support nursing evolving role in healthcare. What I would like to present the first part of my presentation is talk a little bit about key areas that's gonna impact on nursing. These are the key areas that will impact on nursing into the future. The first is demographic change. Based on this picture, you can tell the aging population as of 2022 can vary a lot, especially in this red area. So many nations have already entered a period of negative growth, with over 21% of their population classified as elderly, making them into super age society. By 2050, the global elderly population is expecting to surpass 1.5 billion. We are facing national security crisis right now. Next, I would like to discuss genetic and lifestyles that may impact on nursing. From this picture, over the past 20 years, the growth of chronic disease has far outpacing population growth rate. Average in the past 20 years, population growth rate is 20%. However, conditions such as cancer, 62% increase, mental health, 54, and diabetes, 53, has outrageous growth outpacing our population growth rate. And how much do countries spend on health? Actually, the health costs vary significant across countries, range from 4.3% to almost 17% among OECD nations. In recent years, the focus of healthcare spending especially shift to outpatient services and long-term care costs. Based on the demographic aging society and genetic change, it is required to restructure the healthcare systems. Our healthcare system is composed of several parts, especially from preventive care services to acute care, post-acute care, and to rehab services. Now, new approaches are needed in the future. The long-term care services cover the spectrum across the various stages from health, frailty to disability, dementia, or even to the end of life care. Services need to include community care, dementia care, home services, and institutional care. all aim at providing comprehensive support throughout the aging process. Now we take a look at the education impact on nursing, and you can see the flexible system in the United States allow nurses to progress through various education levels from LPN to DNP or PhD, contributing to the diverse and highly skilled workforce. And APN accounts for almost 12% of US nursing workforce, and APN including NP, CNAs, NA, and nurse midwiferys. And NP represent the largest group, accounting for almost 70%. And currently, there are around 400,000 NP licensed in the United States. Family NP is the largest group, account for almost 70%. However, here in Taiwan and also in the whole world, we need to create more curricula for nurses in the gerontology NP and the mental health NP. In 2006, AACN endorsed the task force on the roadmap to the DNP. Therefore, DNP programs have significant growth in the United States since 2006. There are currently almost over 400 DNP programs. And this growth reflects the increasing demands for the doctor-prepared nurses to lead in clinical practice, research, and healthcare policies. Next, we will discuss workforce impact on nursing. Currently, there are around 28 million nursing staff in the whole world, accounts for almost 60% of all healthcare professionals. The majority are professional nurses. According to OECD report, the number of nurses per 1,000 population varies a lot. Range can from almost 19% in the Switzerland down to only 1 per 1,000 in South Africa. The average is 9 per 1,000, indicating the needs for strategic workforce planning in healthcare system. And let's take further look at the turnover rate. In the United States, the turnover rate recently has increased from 15% to 27% in 2021. Each RN turnover costs an average of almost 60,000 hospital losses annually. And we know the recruitment difficult index in the recent years is extremely increased in the United States, especially in the critical care unit. The average time to recruit an experienced RN is around 90 days. Before pandemic, WHO addressed there are about 6 million nursing shortage. After pandemic, ICN estimate there is a shortage of 13 million nurses in the whole world. WHO recommends increasing the number of nurse graduates by 8% annually. The last key that we are going to address is technology. Technology is one of the fastest developing areas of healthcare in the whole world. The evolution pathway of healthcare technology starts with community alarm to telecare, to APP, to big data, and to robots, etc. In summary, here are different challenges for the global nursing healthcare, including aging population, nursing workforce shortage, disparities in nursing education, fragmented healthcare models. Without appropriate strategies to overcome the barriers, it could turn into a vicious circle for all of us. Therefore, it's important to address the issue of a vision for nursing toward global challenges. To achieve our vision for nursing, we must take decisive action to engage in health and social policy, to amend the legislation and regulation, to expand our nursing education, to extend nursing care model, to work shift and transform nursing through technology. First, let's talk about health and social policy. We nurses, we must actively engage in policy making to advocate for changes that improve healthcare system and patient outcome. As we all know, WHO has identified a roadmap to improve global health and well-being by 2030. This plan is built up on 6 pillars: leadership governance, healthcare financing, medical product technology, information, and robust health workforce. In addition to that, WHO has identified key policy priorities, include investing in health, addressing major health challenges, strengthening public health, and building our resilient communities. These priorities aim to strengthening global health systems. Our action too is we nurses, we need to outline the current and proposed legislative and regulative framework that guide nursing practice, to expand our nursing scope of practice. And also, nursing practice must evolve, especially through updated legislation and regulation, expanding the scope of practice, particularly for nurse practitioner and other advanced nurses' role. We nurses, we need to remove scope of practice barriers. We need to expand opportunities for nurses. In 2017, Elizabeth Iro was appointed as the first CNO, Chief Nursing Officer at WHO, marking a turning point for nursing leadership in global health policy. She identified nurses play a critical role, not only in delivering care, but also in shaping health policies and advocating for universal health coverage. We need to actively advocate for policy change. We need to engage in policy making. We nurses need to value nursing leadership because nursing leadership is important for advocating for policy changing. Nurses must lead at all levels. We can lead from self. We can lead to others. We can lead to healthcare and even beyond healthcare systems. We need to expand and promote nursing education. Nursing education must evolve to include new competencies, such as health policy, adapting new technology, and disaster preparedness to handle complex healthcare environment. In order to meet healthcare demands, it is important to increase the number of nurses with higher degrees. These include upgrade our basic nursing education to the BSN level, to expand post-baccalaureate nursing program, and growing the number of master and doctor prepared nurses. According to AACN, by 2030, the goal for nurses with BSN will reach to greater than 80%. We also need to expand post-baccalaureate nursing program, doubling the number of nurses with doctor or master degree by 2030, because we believe salaries, benefits must be reflected for doctor prepared nurses. We need to conduct more researches to highlight the value of nursing profession. by the use of evidence-based nursing research to speak for us, to speak for the power of nursing. During the rapid growth of digital learning, we have a profound influence on nursing education. We need to embrace digital tools to prepare our nurses for the future of healthcare in the evolving digital world. New and emerging models of nursing care are not limited to acute care anymore. We now need to extend to prevention and management of long-term care conditions to meet the evolving needs from hospital care to overall wellness of the population. New care models such as telehealth, nursing-led clinics are helping to increase access to the care for the future. With regard to employment and workforce shift, the WHO identified we need to aim to optimize healthcare workforce policy and provide effective public policy, leadership, and governance to improve healthcare worker distribution and strengthening monitor HR data nationally and globally. Next, transforming nursing through our technology. Future of nursing involves digital healthcare chains, including virtual care, big data. Nursing needs not only traditional tool, but also robotic assistant to reduce our physical and mental burden. The spectrum of technology nursing care, from telecare to virtual nursing, is going to embrace in our future of nursing. Overall, there are many drivers for change. Patient redefine, workforce shift, new integrated care model, digital device, and big data. Here's the summary for the vision of nursing towards global challenges. Society is changing. Health social care is changing. Technology is changing. We have new roles and responsibilities. We need to prepare nurses for future needs and roles. Investing in education, investing in nursing and long-term care, investing in workforce, investing in leadership. Let's create the future together. In the era of challenges, there are so many choices, and we do believe we have a chance to make such a huge change for nursing. Thank you.
Thank you very much, Professor Chou, for that very insightful and inspiring keynote lecture. Your contributions to the field are truly remarkable, and we are very grateful for your time today. Now, we'd like to open the floor for a Q&A session. Let me share my screen. Yeah. So if you could please submit your questions to Professor Chou through the Slido app, or feel free to post them directly in the chat. Yeah, we'll be able to get the questions. Yeah. Dr. Chuti, will you please be able to? Yeah, Dr. Chuti will be able to moderate for this session. Thank you.
Thank you so much, Dr. Priya. And yeah, considering the time, we're gonna go only through a few questions for Professor Chou. So going from the chat area, we have got a question that says, can you share an example from your setting that explains the application in real world nursing practice? So probably the person is referring to the application for the social determinants of health, I assume.
You mean share an example for that?
Yeah, I share an example from your setting that explain the application of or how nurses can contribute to the social determinant of health in
Let me
practice?
share my screen for that model first, and I will share the example to every one of you.
Thank you so much.
Yes. Now, as you can see from this framework, a vision for nursing framework, and in my country, especially in Taiwan, actually, we are doing so many strategic plans to improve to strengthen nursing for the future, especially for the leadership. We establish a lot of programs for leadership training at different levels for young generation nursing leaders, for advanced senior leadership training program. Based on different kind of leadership training program, we have so many outstanding leaders become the successor leader in the future. And for the education program, currently we have established different kinds of a PhD program. We have DNP as well as the PhD blooming in the last 10 years. And especially for the emergency preparedness, we also trying to improve our emergency preparedness as the central issue across almost over 100 hospitals currently here in Taiwan. And we have so many strategic plans to improve our workforce for nursing. At first, without enough workforce, then we are closing the beds because we don't want to reduce the quality of care for nursing. We have so many incentives trying to to recruit more outstanding graduates from nursing field into our clinical practice. And that's the key areas for us. We pay a lot of attention for that. And nursing right now, we have so many nursing leaders to service in the very important position for the whole country, that we can focus on our policy making and also trying to change the regulation that's out of date. And that's a very good example. That's why we're trying to change the payment system currently for nursing practice as well. And during the evolving chain, we pay attention. Right now, we have so many advanced care model in Taiwan as well, trying to update it for the aging population. We also prepare so many updated technology for us, trying to when we're facing the aging population today. And those are the issues and a very good example that we adapt from this framework and try to improve the nursing practice for the future. Thank you.
Thank you so much, Professor Chou. That was a great response. Another question we have is, given the demands on nurses in terms of workload and responsibilities, is it realistic to expand nurses' scope of practice to include work around social determinants of health?
Yes.
Yeah.
Yes,
It's a
my
tricky
answer is
question.
yes. I'm sorry because when I mentioned in my presentation, the scope of practice, especially, is extremely important for the advanced nursing's role. For example, the prescription right. Without those rights, we have only limited power and limited resources for us to practice in the community. However, nursing's role needs to be expanded because our future for our population change is we have to pay attention on community service. Therefore, we need to protect, to have extended a scope of practice for those nurses to service in community in mental health. That's why we definitely need to expand more critical role for nurses in nursing practice. Thank you.
Thank you so much. And quickly, the next question says, in Nigeria, new policies are adopted, e.g. task shifting and task sharing policies. What is your opinion on this?
I beg your pardon, sharing policies?
Yeah, so there are policies around task shifting and task sharing.
Okay,
So what is your opinion considering
you mean
dual
the
prognosis around social determinants of health?
workforce shift? If our workforce still focus on acute care, then we ignore 70% of the aging population in the society. So that's why we need to shift our workforce into community. I know it is not okay right now because the majority of workforce in the acute care is still not enough. However, if we did not shift that, that means we need to incorporate with technology to service in the community. Without doing that, we are not providing enough space for service for our people who need us in their community. That's why workforce need to shift a little bit from 70% in acute care to community service, because the majority of our patients may not be focused on acute care anymore.
Yeah.
We need to redefine our patient. Our patient will include a lot of proportion. They're located in the community. Okay, thank you.
Lovely.
And can I add something to that, Shudi? Just quickly,
Sure.
because there's that other type of shifting of the roles that are not nursing, shifting some of the tasks that are currently healthcare workers do to non-healthcare workers, so that you expand the capacity of the community to provide care for itself in a way. So that's another type of shifting that is probably more than we can discuss today, but it has implications for workforce, I guess.
Thank
Lovely.
you, Natalie.
Lovely. Do we still have time, Priya, to take one or
know,
two more questions?
I think we have to move on, and I think we can take questions in the following sessions.
So
Yeah.
sorry for the others. We will take more
Mm.
questions at the end of
Yeah.
the program. Thank you so much,
Thank you.
Professor Chou.
Thank you very much, Professor Chou, and thanks, Dr. Mohammad Chuti and Dr. Cutler.